fraud attorneys. When you call the next competitor up, you say, okay, come on, you're up next. Sorry about that. Old habits are hard to die. Please introduce yourself.
So I really am Chris Pitt from the University of Pittsburgh. Absurdity hasn't left me the 27 years I've been here. And this was the time of year I went to the welcome to new faculty reception, and I had my name badge on. And as I walked up the receiving line, my handshakes increased in intensity, smiles, and sincerity until
I cannot answer that.
I'm asking what you're
I understand what you're asking. I cannot answer it.
Sorry. There was
I can't.
Rube Weingartner, the provost at the
I
time,
don't know.
rather than shake
I'm
my
not asking
hand,
that question. I was
both
just
arms
making a
around me,
statement.
embraced
My
me,
question
and
is,
said, "Welcome
will
home,
this
son."
be available? When will this be available?
So I'm the chairman of our Department of Environmental and Occupational Health in the University of Pittsburgh Graduate School of Public Health. I've got a PhD in environmental health from the Johns Hopkins University, and prior to my current position, I was on the faculty in the School of Medicine at Yale University and University of Pittsburgh in pharmacology. My work is on the pharmacology and toxicology of the lung, and I also have a leadership position in the university trying to organize and direct new efforts as they relate to health effects around Marcellus Shale area. So I don't have slides, which is going to be a little stressful for me, but better for you. And I'll try to stop in a timely fashion so that we have a much more significant experience already underway at West Virginia University that Dr. McCauley can elaborate on too. I can say at the outset that the health impacts of unconventional natural gas development have been the subject of several recently published reviews in which they've assessed evidence-based types of peer-reviewed articles as well as reports from conferences and individual experiences in various fashions. This has been true for work by physicians and scientists for health, Society of Toxicology, working groups in the National Institute of Environmental Health Science, and the Institute of Medicine, National Academy of Sciences. Today, literally today, May 1st, a report appeared on the internet from a very important group, the Council of Canadian Academies, their National Academy of Science equivalent, on the impact of hydrofracking in Canada. You can access that on www.scienceadvice, one word, scienceadvice.com. And in it, they commissioned a large group of multidisciplinary scientists to consider the impact, some of which we've talked about today. And after 2 years of work, they've come to a very contemporary but concise conclusion that there's extraordinary gaps, especially as they relate to health, and that's what I'll outline in the next few minutes. So their conclusions were there was a need for well-targeted science, and the current data about environmental impacts are neither sufficient nor conclusive. And I'll go over some of the shortcomings that contribute to that, at least with respect to health effects. They summarize that one-size-fits-all assessment won't work. In Canada, their concerns were British Columbia and Alberta are the sites of their current activity. The future will be in Quebec, New Brunswick, and Nova Scotia, different demographics, different geology, and the like. The same way applies to Western Pennsylvania when information from Colorado is some of our best now, and whether that applies to here. And frankly, would probably even apply to Deer Lakes, in which information from other parts may or may not be completely informative and have to be considered with some of the details that the previous speakers alluded to in terms of climatology and local geology and the like. The report noted that there's rampant cynicism amongst individual citizens, and so issues of transparency and open communication are critical. And in this respect, I congratulate the council here for holding this series of meetings, because it's a truism in environmental risk assessment that an informed public, as we're now embarking on, can reduce and abate the types of skepticism and psychosocial stress that are critical components of all this. I can be a spokesperson for our School of Public Health. It was formed 60 years ago to deal with health effects of our steel workers and the residents who lived in a much different environmental community, and the same concerns still apply in this contemporary type of climate with more shell efforts abounding. And then Mike can elaborate shortly after on what we've learned in West Virginia. So why is it that we don't know more about health effects? And the invariable first conclusion is that there's no opportunities to do baseline studies. These things have been imposed on us in such rapid fashion, and it's largely true, and when opportunities arise, as we'll allude to momentarily, they have to be grasped with great enthusiasm. At the opposite end of the spectrum, the health effects, both on ecosystems and humans, are likely to take a considerable amount of time to manifest. And so coming to clear conclusions in a brief period of time is going to be virtually impossible. The elements that comprise possible exposures, either in water or air, are dynamic, as we've heard today. And so the conglomerate life cycle of an unconventional natural gas development has to be considered in total, although most research efforts are dissecting individual parts of well development, well production, and the like, as we've heard. There's inadequate monitoring, and Mike can tell us how things are improving in West Virginia and what we might be able to do regarding these things. And from a toxicologic point of view, there's a daunting challenge with chemical mixtures. You've heard of the hundreds of components that go into the ground. Even as they're being revealed on a voluntary and thankfully helpful stance by industrial concerns, the net result for toxicologists is to consider these in combinations and permutations that we'll find challenging. It's also unclear, as you've heard today, what the toxic contributions are going to be from the material that emerges from under the ground that had less to do with what entered. And these are the bromides and the metals and the potential naturally occurring radioactive materials that we discussed before. The non-disclosure agreements are a hurdle too for epidemiologists, toxicologists, and the like. And the lack of registries, certainly in Pennsylvania, to provide what we've come to know as public health surveillance is prohibitive too, and even precludes the lofty goal of providing important biorepositories as we learn more in time from potential biological samples and biomonitoring. And lastly, the claim by industry is really somewhat obfuscating that hydrofracking has been done for such a long period of time with relatively little detrimental human health effects to report with it. And the fact of the matter is the industry has changed greatly in the last few years. And the high volume hydrofracking is producing a scenario that needs to be evaluated in its own without being historical background. So very briefly, what's known? Occupationally, we know quite a bit. The workers have excess mortality and morbidity. Most of the mortality is accidents and trafficking and stuff. The morbidity is with peculiar scenarios such as unguarded use of silica in extraordinary amounts there. These are being documented to a certain degree and dealt with various different government levels. For the communities around these well operations, as you've heard before, we worry about air pollution, and we worry about water pollution, and then we worry about psychosocial and behavioral things. In the air, we have components from the well development as well as well production that are unique to them in terms of chemicals being introduced and how to deal with them. Some of them add to the elements that also exist, which are the more commonly known criteria pollutants like particulate matter and ozone, sulfur dioxide, carbon monoxide, and the like. But then there's the additional aspects of the procedures themselves that produce hazardous materials. We only consider it an industrial and environmental thing. The so-called B-taxes and the like that have also been a subject of previous discussions here. So what have we learned about these things? Probably the best data is from Colorado, and in 2 studies, their drilling is in a rural area in the part of the state, but nonetheless they were able to use from the University of Colorado highly contemporary analytical approaches on fence line measurements around their sites, and they could take inventories from their measurements, make predictions about risks and hazards, and could identify an increased risk of residents that live within a half a mile for both cancerous and non-cancerous endpoints compared to folks who live greater than a half a mile from well sites. So this was an important study 2 years ago, and they followed up on that, the same group, John Adgate and colleagues, by doing a retrospective study, and that was just reported last month in the Environmental Health Perspectives. And here they compared case control of four groups of residents that lived with proximity and density of wells as the surrogate of exposure. And the greater the density of their exposures to these wells, the more likely and the higher the risk and odds ratio was of congenital heart disease and to a lesser extent neural tube defects. So this was the first kind of important association, but association only, with human health effects that is gathered a lot of attention. The group was circumspect and self-critical about the limitations of a study like that, and they involve problems of association only in epidemiology. There is a need for more precise exposure measurements to identify the putative etiologic agents and the like, but they hypothesize that benzene and materials that have a history of producing these sorts of defects might be the players involved. For us, we've tried to follow their lead. We're just starting now at the Graduate School of Public Health, and we've been monitoring indoor air pollution in homes of residents living near and away from unconventional natural gas operations in Washington, PA. And we've just started to collaborate with the Allegheny County Health Department, in which there's an opportunity, as I alluded to at the beginning, to get baseline measurements. And so these are the wells that are being drilled in the airport by the Consul group. And we'll have access to the airport site with cooperation from both the county and the airport authority, and be able to add our particular abilities to do high density monitoring along with their sophisticated passive monitoring of solitary sites with the EPA around one of the well pads in the airport, well pad 2. Just as the group in Colorado tried this retrospective thing, we're in the process of reproducing some aspects of it in a perinatal outcomes study with large groups of pregnant women who resided by geospatial analysis in proximity to wells or further from wells. And the results hopefully will be forthcoming, as the group in Colorado didn't find changes in birth weights, which were touted to be possible due to proximity in wells here. Water pollution, you've heard a lot from Dr. Stoltz and others before. There's really compelling data, and perhaps Dr. Small will elaborate after me, from Dr. Jackson and colleagues at Duke and other places, that indeed there is migration of geothermic sources of chemicals and gases and that are associated with proximity, again, to residents living near wells. Whether there are health effects or not, it was never the topic of those investigations. And many of the objectives there were methane itself, which has a minimal profile for acute or chronic health effects outside of asphyxiation. In this regard, our School of Public Health was able to approach an important aspect of all of this, was also alluded to before, in terms of the disposition of the flow back and producing water, and where it's held and disposed of and reused and the like. And at the time, just a few years ago, the policy for lots of these companies was to use municipal or private wastewater treatment plants, and they're now well known to be woefully inadequate in removing complex chemicals from that kind of mixture. And the practice, as best I know, is still just voluntarily being stopped there. And then lastly, before I turn it over to Mike, a big component of all of this is psychosocial and community behavioral things. And health is just not being not sick, but having a quality of life that's compatible with that. And certainly all of these processes are well known to produce individual anxieties. Indeed, a study that we did with Dr. Goldstein recently showed that the persistent concern of citizens that lasted throughout the years and didn't disappear were mistrust and distrust of public officials and the monitoring that was going around them and the like. The water and the light and the noise conditions seemed to subside. And so what's going to be critical and undoubtedly a part of all of this, and indeed today is a good example of all of this, is the involvement of stakeholders and individuals in the process. So community-based research has a long history in environmental health science and undoubtedly will be used for purposeful achievement and a common goal under these conditions. And these sorts of meetings are one example of how this can work. So now, Michael can introduce himself and share an experience with West Virginia.
Is it okay if I ask one question? No, I have a tangent question. You mentioned that methane causes acute and chronic health problems. Can you tell me, is it asthma?
No. So of all the agents we've discussed today, methane probably has the lowest profile because of its lack of reactivity in human health, as best we understand. So it can displace oxygen depending upon the environment. And it's what caused the canary to fall down in the mine and what causes the mine to explode occasionally. Such explosion.
And so, what is the result of constant light and constant noise? I mean, it's never dark. I mean, it's an industrial site. There's a constant drone, lawnmower sound. But I would think that would affect my psychology.
Certainly the stress is in large part based on those kinds of features, and maybe West Virginia too. And in doing surveys of individuals, these are key features beyond air and water pollution that are brought up, light and noise. But this issue of mistrust and cynicism is an extraordinary, persistent, and unique one. And so it's a fundamental element of risk perception that if you're uninformed, and so this sort of information reduces that you'll be unable to deal with the stress of a situation like that. And then lastly, if you feel that you're part of the solution and a contributor, that you can mitigate and abate some of the stress induced by those perceptions.
Thank you.
I'm Dr. Michael McCauley. I'm from West Virginia University from the School of Public Health. I am the interim chair of the Department of Occupational and Environmental Health. And before coming to this position, I spent 27 and a half years in the U.S. Public Health Service working for the Centers for Disease Control and Prevention as part of the National Institute for Occupational Safety and Health. And in that job, I did some air pollution work, although the National Institute for Occupational Safety and Health doesn't generally deal with air pollution. The CDC does. And so I was sent to Mount St. Helens to assess exposure from volcanic ash. I was also sent to Kuwait during the oil fires to assess the exposure from oil smoke on U.S. citizens living and working in Kuwait. I could say that I've had a disastrous career because of that. But we'll leave it to others to make those judgments. Most recently, though, the West Virginia legislature required the Department of Environmental Protection to begin a study on the hydrofracturing industry in West Virginia to determine mostly, to start with from an air emission standpoint at least, the effect of the setback rule that they have. The setback rule is the distance that a sensitive location has to be from a well site, in this case the middle of a well pad. And so I did a study of the air, noise, and light emissions from hydrofracturing operations at 7 different locations in West Virginia. And that was done in 2012 during an 8-month period and was funded by the Department of Environmental Protection. There is a report that is available to the public on the West Virginia DEP website. Along with my report, there are also reports on the effects on water quality and the effects on impoundments for the hydrofracturing industry. So there are 3 reports altogether that are available for the public to download. What I found, and in fact was asked to appear before a joint committee of the legislature on, was that the setback distances were not effective. 625 feet back is not an effective setback distance because the nature of the industry, the nature of the topography of West Virginia, and the meteorology of West Virginia make a single setback distance irrelevant. It's not a one-size-fits-all, just as the terrain is not a one-size-describes-all. So you could have a hydrofracturing site sitting down in the valley, and the pollution that might come from it could be at entirely different levels than one site sitting on top of a mountain. Presumably the one sitting on top of a mountain would be lower, although there are instances where they could be similar. And so instead of saying that there should be a setback distance, what I prescribe and what I think is applicable to almost anyone who's doing this is the use of direct reading monitors. By using direct reading air monitors, light monitors, noise monitors, one can keep track of what's actually being emitted at the site. As believe it or not, there are national ambient air quality standards that the EPA has that are for protection of the public health, but are really not applicable to hydrofracturing. And in fact, really not directly applicable to human health because there's no way to find an individual based upon the either meeting those national ambient air quality standards or not meeting those national ambient air quality standards. The effect is really on the state and the Environmental Protection Agency of the state that is acting for the U.S. EPA. So what you have to fall back on, in fact, is control technology. The EPA requires the best available control technology, and that's sometimes they use the acronym BACT, ACT. And in this case, continuous monitoring of a location could be considered best available control technology because it can be used to feed back to the operators of the site what the emissions are, what the levels are that are occurring as part of their activities on the site. So if you're making too much noise, it's helpful if the people making the noise would know it. And so I suggested to the legislature that that be a requirement of any operation that's being set up and that the cost be borne by the operation itself. And that the data be made publicly available so all of this is transparent. And in that case as well, best available control technology would also require that good quality assurance and quality control practices be carried out as a result of the information gained from these. So if you're getting too noisy, then you need to cut the noise back and the noise levels should not fluctuate wildly. And that's the same as in almost any industrial situation. If you're making widgets, for example, and you want to sell those and have people rely upon one widget doing the same thing the next widget does, you have quality control and quality assurance to make sure that you have standardized the production. And here all that we're talking about is standardizing the production. And as far as I know, this has been broached to both the Marcellus Shale Coalition and to environmental groups in the area, and both have subscribed, I think, to that. And the legislature seems inclined to adopt that into law. So you could sample for the gases that are involved. And when we did our sampling, we found, in fact, not surprisingly, the BTEX compound, benzene, toluene, ethylbenzene, and the isomers of xylene were present at virtually all of the well sites that we went to. And benzene itself was above the minimal risk level that has been proposed by the U.S. Centers for Disease Control and Prevention. In some cases, substantially above, which is worrisome. The minimal risk level is that level below which one can expect no health effects to be seen. And above that, in increments of that level, the higher the incremental level, the higher the possibility of ill health effects being seen. And so we saw levels that were anywhere from 10 to 30 times the minimal risk level for benzene in these hydrofracturing sinks. And that's a problem. In fact, the levels reached 85 parts per billion at one site. At 100 parts per billion, the National Institute for Occupational Safety and Health recommends that workers working in that condition wear respiratory protection. Benzene itself, by the way, is a carcinogen that causes leukemia, and that's been well established.
So it causes what?
Leukemia. And in fact, actually, the minimum risk level is not even based upon it being a carcinogen, because there is no minimal risk level for a carcinogen. It's based upon immunological reactions that can occur in the body due to exposure to benzene. So, with that in mind, any exposure to a carcinogen is not tolerable. And we are looking at ways also of assessing this. Currently, I have work ongoing in Ohio County, and that ongoing work, that's Ohio County, West Virginia, where Wheeling is. And in that work, we've seen high levels of what are called ultrafine particles. Ultrafine particles are particles that are a tenth of a micrometer and less in size. And currently, the EPA limits are based upon particulate matter that's either 10 micrometers or less in size, or 2.5 micrometers or less in size. And there's debate, in fact, over the toxicological correctness of both PM10 and PM10.5. So you may, in fact, not actually be protected by those standards from the EPA. So I'm not going to do any industry bashing here. I'm going to do a little bit of regulatory agency bashing. And I usually do that whenever I see folks from the EPA. So, the ultrafine particles, the problem in the literature with exposure to ultrafines seems to be that they're potential causes of cardiovascular disease, of cancer, and of pediatric asthma. They may also exacerbate existing cases of pediatric asthma. And the levels that we've seen around the hydrofracturing sites are higher than the levels we saw in southern West Virginia in a study that we've just recently published on mountaintop mining. And the mountaintop mining area that we were in had higher rates of lung cancer and higher rates of lung disease and deaths from lung disease as well. And the distinguishing feature for that were, in fact, the ultrafine particles. And I've also made the same recommendations that I'm making to you in a peer-reviewed scientific article that was just published a few days ago. And so, if you want to know what you should do, and it seems to be the question everybody's been asking, one of the standard ways of approaching this would be a health impact assessment. And I've noticed nobody has mentioned that you should be doing a health impact assessment. That would allow everybody to have a fair chance to talk about what the problems are, maybe even discuss possible solutions, and usually for a community to arrive at a mutually agreeable solution. Because if it's left to one side or the other in a situation like this, people are going to pick what's best for them on their side. And if we want to hear out both sides and be fair to both sides, then a health impact assessment is probably the way to do it. Thank you. If you have any questions, I'd be glad to answer.
Do you have any questions, Jim?
Thank you.
Wow, it was a lot. And I just want to tell everyone here how fortunate we are that Mr. Michael McCauley was visiting Dr. Pitt today, and he called and asked for I do have a question, and I asked the industry people this question, and but I'm going to ask it to you, see if you give me the same answer. Benzene is a byproduct of diesel, correct?
Correct.
Usage. So we're using diesel trucks that come and go. We have the drilling rigs are run by diesel. And I was told that once the diesel's burnt, the benzene's gone. Is that not true?
Well, we saw 85 parts per billion of benzene, so obviously it wasn't gone. And in fact, the diesel trucks also produce the ultrafine particles, and we suspect that's probably the major source around these hydrofracturing operations. These are not just diesel trucks in many cases. These are large diesel engines, the size of train engines, on the pads that are used for pressurizing the well site for the hydrofracturing, along with all of the diesel truck traffic coming to and from the site.
So you're saying the compressor station,
Yeah.
right, is using diesel.
Yeah.
And this is the way it was explained to me, that benzene's heavier than air, so when it comes out, it's going to go along the ground, right? It's heavier than air, and so that's why it affects children, because they're closer to the ground.
All of our sampling was done 2 meters off the ground.
2 meters off the ground.
And our levels of benzene were taken from SUMA canisters, which are evacuated cylinders, and the sampling period was 3 days, so that 85 parts per billion was the average over a 3-day period.
The other thing, you talked about having these monitors. Are they expensive? I mean, is it something that industry could, that we could require the industry to put these monitors somewhere?
Compared to what's spent on a standard well site in a day, you'd probably have trouble finding it after the decimal points. If you rounded it.
It's cheap?
Yeah.
Oh, okay.
Relatively.
Well,
And they're reusable.
And they're reusable, cheap
Yeah.
and reusable.
And they only have to be used there while they're doing the drilling. And so they can move it from one site to another to another. So the cost per site, if you divide by the number of sites it's going to be used at, really does become very cheap.
So, just in your opinion, the technology, I mean, this is coming to us fast and furious. The technology's new, and we don't really understand all the impact on what it's going to be. But there's also new emerging technology, and hopefully industry will continue to improve. But we're not there yet, or we're working on it.
Well, in our understanding of what the emissions are, where they come from, and what health effect they may have, we are kind of still learning a lot. However, I will point out that the idea that I proposed about sampling around the site, that's called fence line sampling, and has been used in most of the chemical industries for the past 40 years.
Can you explain that just a little bit more?
Sure. If you want to know what happens at the border of your plant boundaries, you put up a monitor there. And if you go to Charleston, West Virginia, it was pointed out, and visit one of the chemical plants in that area, you'll find monitors at the fence line of those chemical plants. And it's standard operating procedure, both for the plants and in fact for the Department of Environmental Protection to do the sampling at those locations. The only thing I'm suggesting that we add to that, that they may or may not have right now, are simply radio transceivers to take the information and radio it back to wherever they're doing the controls in real time. And those are maybe $100 a piece, so it does not add substantially to the cost or to the technology.
And just to confirm, there's no acceptable levels of benzene, correct? There's no acceptable?
There is no level at which we can say for sure it won't cause cancer.
And benzene attaches to dust particles and can travel with the wind.
Benzene is a gas that will travel with the wind. That any amount of convection, in fact, will take it up and pick it up and carry it along. To get it to hug the ground like that, you'd have to have really, really calm air.
Okay. Thank you so much.
Well,
Well, last but not least is Professor Mitchell Small from CMU. And I think we should clap for him because he's last but not least. And I appreciate it. Oh yeah, we're now almost 3 hours. Wow.
Well, I'm going to clap for you.
Oh, yeah.
Okay, I think, I guess one of the good things about going last is enough people have left that there should be a copy of the slides for everybody, right? So you could follow along there. So I am Mitchell Small. I teach at Carnegie Mellon University. And I think I was asked to be here in part because I am currently chairing a National Academy of Sciences committee. Is this on? Mm-hmm. Okay. On risk management and governance issue in shale gas development. This committee, the principal activities of this committee, next slide, were to convene 2 workshops. First of all, the committee itself has about 10 members who are leading scientists from across the United States in both the physical and social sciences and law issues related to shale gas development and environmental and energy issues in general. So it included, one of the members was Bernie Goldstein from the University of Pittsburgh, School of Public Health, a colleague of Dr. Pitt, and with particular expertise in the health sciences, health issues. And at the workshop, we had people from all over the world, from industry, environmental scientists, and academia, who presented both on the risks at the first workshop and then on the sort of governance, risk management issues at the second one. We do have, I have some information there on how you can find out, see the slides from all the presentations and even a videotape of all the presentations. I think our major output is coming out right now. It's a special issue of the Journal of Environmental Science and Technology, about 14 papers. We just sent in the overview paper, which kind of guided some of the things I'm going to present today. And I think it's going to be the most comprehensive and important documentation of shale gas risks and risk governance issues that has come out as yet, certainly in its scope that it covers. Next slide, please. So at the first workshop, we did address some of the principal domains of risk. You've heard a lot about these already today. Those would include operational risks. So this is the third slide, the top one on the second page, including mishaps, occurrence and detection, induced seismicity, which thus far has not really happened very much at fracking sites, only at return water, wastewater, deep well injection sites. A number of occurrences in Oklahoma, some in Texas, and some near Youngstown, Ohio. And in fact, that's why that practice was stopped there And that's one of the things that actually pushed for this recycling you heard about, which has some side issues associated with it, is because we just don't know what else to do with this water. We were injecting it, but then we got some 5.3 earthquakes near Youngstown. The water issues, both surface water, source water drawdown, and this management of wastewater, they're actually fairly well studied. Still lots of variability and lots of concerns and lots of issues associated with them. Air quality issues include local criteria, pollutants and air toxics that we just heard about. Regional ozone formation from the NOx at the generators, as well as the reactive hydrocarbons, and then global methane, which I can get to if you look at item number 4. Let me just talk about for a minute the global climate issue. That hasn't come up yet, but it's one that people are concerned about from a number of perspectives. There's really 2 issues. One is how much methane gets out during the whole process. And so that's what you would call the leakage issue. And there's a fair amount of controversy there. Folks that measure leakage directly tend to come up with much lower estimates than folks that try to do mass balances over large areas in the atmosphere. Part of that may be there's problems with each of those approaches. With the leakage measurement, part of it is it's hard to get what are called the heavy tails. If you have just a few big belchers that are out there, you need to monitor a lot of places to get them in your sample. So just a few of these real, bad actors can lead to big emissions. So that's that problem. The problem with the atmospheric measurements are there may be other sources of methane having nothing to do with shale gas operations that might be contributing to that. So what we need to try to do is to bring these 2 approaches together and have them study the same place at the same time with a rather comprehensive study. That's one part of the global climate issue. The second part is sort of more the economic implications of having cheap natural gas. So in the short term, it appears as if there's been a positive benefit to shale gas, cheap shale gas, in that it has displaced coal. And by most estimates, therefore, reduced greenhouse gas emissions somewhat for the time being. The question is in the long term, is that cheap natural gas going to delay the introduction of renewables, particularly wind and solar, and therefore result in long-term net increases in greenhouse gas emissions? One of our 14 papers from Duke University is the most extensive and comprehensive analysis of that issue using economic models to look at it. So again, it's up in the air. Number 5, ecological. Big issues are habitat disruption and connectivity issues, particularly if you build lots of little roads for lots of different well pads. You'll see that's why you need comprehensive planning, not just one well pad at a time. I'll get to that in a minute. Human health, we've heard all about that. And the same issues were raised with worker safety, pollutant exposure effects, and stress, traffic, light, and noise. And then community social issues, economic impacts on existing industries like tourism and agriculture. So you could have a negative impact on those. It's not just positive. Will that happen in the Deer Lakes area? I don't know. It's possible. Boom bust cycles, the equity and benefit cost distributions, who gets the money, who gets the externalities or the negative effects, and community conflict and trust that we just heard about as well. And how do these things interact with each other? We have no idea, but we need some study there. Next slide, please. So the big risk governance issues are the fact that I think most of you know, or if you don't, you should recognize that the U.S. federal role is very limited by formal exemptions in environmental legislation. So the oil and gas industry is exempt from a lot of this, and so therefore, all the action's been at the state level. So there is this rapidly evolving state-focused decentralized system. However, third bullet, state agencies and programs are highly variable in their approaches, in their capacity to enforce the rules and regulations and programs. and to the extent of local land use and rulemaking autonomy. That's what we heard a lot of. So one of the papers in the special issue compares Colorado, Texas, and Pennsylvania. Pennsylvania, as you might understand, local authority is very minimal in the law, Act 13. The state pretty much can tell locals what to do. In Texas, they grant a lot of autonomy to local land use and decision-making. Colorado's kind of in the middle. Okay, next slide. Okay, what I do here is try to identify some of the critical areas where we know even less than some of the other areas. And I think I'm just confirming what we've heard in the last couple slides here, that there's really current research and analysis are insufficient to either confirm or preclude many of the important impacts, and that better monitoring is necessary, particularly baseline pre-drilling monitoring, if you're going to know whether or not environmental quality and population exposures are subsequently affected. So that would include water, ecosystems, air, as well as indoor air, personal exposure, biomarkers, in order to characterize that. The bottom bullet really reflects what we think ought to be at least a minimal federal EPA role to require a better information standardization, collection, reporting, and dissemination, as well as public disclosure, applying, of course, to hydraulic fracture influence. Next slide. New initiatives in governance. We heard from the CSSD. We do talk about that. We had a presentation there on voluntary standards and certification. We were very supportive of that, although many people felt that that alone isn't sufficient. It has to be in combination with an effective regulatory program. I'm going to talk about comprehensive development plans and what particularly Maryland is doing on the next slide, so let's hold off on that. And then there's some things on, again, on the potential federal role. We had some presentations on, it's still, I believe, in the proposal stage and undergoing still public comment, but we were pretty impressed with the Maryland proposal for what's called a mandatory comprehensive gas development plan that has to be developed. In this case, it's developed with the Maryland Department of Natural Resources, and then it has to be discussed in lots of public meetings, and then it has to be approved and permitted by the Maryland Department of the Environment. So there's two agencies that are involved jointly there. The idea is to enable coordinated planning to maximize the use of existing infrastructure, avoid sensitive areas, minimize cumulative effects, even provide operators with decision support tools to help them in their compliance planning and report preparation, and to ensure a high degree of community and stakeholder participation in site selection and implementation. So the plan has to specify the locations of all planned well pads, roads, and pipelines and supporting facilities over a period of 5 years, and comply with all land use, location, and setback regulations. So I don't think a plan that said we're going to put some wells somewhere would pass these criteria, at least proposed criteria. And then very comprehensive requirements for monitoring and disclosure, and some of those are on the last slide. Let me just mention at the top of the last slide that that the Department of Natural Resources in Maryland expects a minimum of 2 years of pre-development baseline data to evaluate the condition and characteristics of water resources, particularly those with living resources. I guess that's fish and biota. Since statewide monitoring experience demonstrates there's a great variability on a seasonal and annual basis. Now, Maryland, unlike Pennsylvania, still does not allow fracking. They took, I guess, the approach that we ought to get the information first and have our rules in place first before we start. And we're supportive of that. They actually have a fairly small area with shale, and the Marcellus Shale goes really only under the Allegheny forest area in western Maryland. That's spelled differently than I think our Allegheny, right? But in a sense, it's a recreational type of forested eco area that may, perhaps, I haven't studied the Deer Lakes area, have some parallels there, and the role of particularly being concerned about water resources and ecosystems, as well as potential human exposures and impacts. So I guess I would encourage somebody from Allegheny County to look into what's happening in the Allegheny Forest and in the state of Maryland. Pardon?
In Maryland.
In Maryland, you're right, in the Allegheny Forest of Maryland.
We have one up north too.
Pardon? Oh, that's true, we did have one up north in New York State, right? Yeah. Well, that's, I guess, the whole thing is called the Allegheny. Okay, I am have completed my presentation, and I can take a question or two if we're allowed.
Dr. Small, I really appreciate you being here. I can't think of any, it was really thorough. I can't think of any questions. But I was wondering if maybe Dr. Stoltz had a question. Do you have any questions for him? No?
That was, well, again, it's Deep Creek, and
That's like a deep
in Maryland.
right?
So they're balancing there that Deep Creek generates $1 billion a year in tourism, and they're balancing.
And so Deep Creek, Maryland, where my family takes vacation, is where the Marcellus Shell is.
Yes.
and-
The question is, can they hide it?
Right.
Can they hide well pads there?
yeah.
Yeah.
And so just to confirm, Professor Small, you said that Maryland hasn't permitted it yet, and they think that they needed a minimum of 2 years pre-development baseline. So, like, let's say we were living in Maryland, and Maryland already legalized fracking, or, Marcellus Shale development. We would have to do a 2-year study of Deer Lakes Park and analyze all of it before we begin drilling there.
That's correct.
Oh, she has a question.
Yeah, I guess my question would be, I thought you were saying that you don't feel we would be doing due diligence if we didn't know where all the well paths were going to be placed around the
You just
park.
use words that are above my pay scale. Legal implications, and I'm not a lawyer. But what I did say was that it would seem like a plan that had that wouldn't meet the criteria of the comprehensive gas development plan that is proposed for Maryland. It's still undergoing public comment.
Thank you.
And Professor Small, do you think it's important to have a hydrogeologist, I can't even talk anymore, a hydrogeologist study the land before you start drilling upon it?
I think it's necessary to have a multidisciplinary team of health, environmental, ecosystem, water scientists that would study this. Maybe there are some consulting firms that apply this. It's the kind of thing that you would do in a broad-based environmental impact statement. And there are places that require environmental impact statements. I think, again, the Maryland plan is similar to that. I know in England, they do, for their plan, they're going to require environmental impact assessments and statements. So that would, require, to look at all of these issues. And hydrogeologists would certainly be able to address some of the important ones, but there are other issues as well.
Thank you. So everybody, thank you so much for coming. I want to thank the speakers. I really feel blessed. I learned so much, and this was an informational gaming event for myself, and I hope everyone else learned, and I want to thank you very much for coming. It means a lot to me.
Thank you.
Have a great